think I live. Good morning, Facebook family and friends. This is Saturday morning with Dr. Mama Rosie Thompson. And I'm always trying to do something once I get ready to go live. So I'm going to look on Facebook. Okay, I see us on Facebook. So we are live. This is Saturday morning with Dr. Mama Rosie Thompson. First and foremost, want to thank you all for joining today. Really appreciate all your comments, all the feedback that we've gotten on the site. Uh, we're using a different site today so that I could bring our special guest on today. And I want to just to say to you that Dr. Henderson does not practice in the state of Illinois. She has decided to come on and help us to talk about therapy. So if you have specific questions that you need for your therapist, I'm always recommending that you seek counseling, especially when you're making these life decisions, that you seek counseling because you got somebody there that can just hear you and guide you through making the best decision for your life as we work to come in the best that we can be. So we continue to do that. We continue to talk about that. We continue to talk about how trauma affects our lives and all the things that we've talked about in the past. So today, I'd like to introduce you. She's my niece, my great niece. Her name is Dr. NaToya Davis Henderson, and I'm going to turn it over to her to let her talk to us a while about therapy, counseling, and then and tell us what she does, whatever she wants to talk to us about, and then I'll come back and we'll talk a little bit more. But if you have any questions, please post them on Facebook. As you post them and they come up, we'll begin to talk about them and answer your questions. So thank you all, and thank you, Dr. Henderson. Really happy to have you join us today. And I'm turning it over to you, and I'm going to mute myself, but I'll come back on if there's a question that I need to come say to you.
All right. Good morning, everyone. I am Dr. Davis Henderson. I've been in the mental health field for 14 years as a mental health professional, a therapist. And in that time, oftentimes, you experience, or in my experiences, I've encountered a range of different populations, demographics, a range of different diverse issues as well in my interactions with those that I've assisted in therapy. And so with that, a large part of the therapy process is engaging, for one, the client or the patient, helping them to increase awareness around those presenting concerns and symptoms that are causing barriers or strain in their lives in some way. And so a part of that, and specifically when we are looking at what therapy can do to benefit those that have experienced trauma in some way, a part of that awareness is looking at those specific symptoms that that individual is presenting with, because as we know, we're all individual beings, and so with that, we often benefit better from an individualized care plan or treatment plan. And so with that, that's one of the first steps in the therapy process, looking at developing a care plan, a treatment plan with your clinician, that the person that will be working with you, or the team of professionals that will be working with you. And so with that, it's the back and forth relationship. I know one of the misconceptions oftentimes is that it's one-sided. Yes, the therapist is the professional, but in therapy, the relationship is a dual. And I wouldn't say dual, but it's a relationship, because that's something completely different. But it's a back and forth interaction between that person and the therapist. And the way that I describe it in my interactions with those that I assist is that this is your time. Even if in that session you're in there and you're not talking about something that you directly came in or initially came in about, it's all connected in some way. And so going back to those symptoms that are there, oftentimes increasing that awareness of what that looks like for you. And I'll give you an example of what I mean when I say that. So let's say that an individual has been in a car accident, and because of that, they have a broken leg or an injury, a broken bone or something like that, that's visible, that's clearly this is what's going on. And so they go to the emergency room or they go to the doctor, and the doctor, this is something that we know. So this is what we're going to treat, because you know that it's there. And as a physician, a clinician, they see, okay, this is what's going on. But up on further examination, you begin to say, well, I'm dizzy. I'm getting lightheaded. When I try to stand up, I'm falling. What is this? That's in symptom. Those symptoms are not directly observable. Like, you can't see that from a broken bone. So you may have something else that's going on. And so further examination, will be done at the hospital. You'll have all these tests, these scans, and from that, they reveal that you have a concussion. But that concussion is not noticeable just by looking at you until you begin to present with those symptoms that you are showing. And so similarly to trauma, it's the same way. Oftentimes we won't know what to identify it as until those symptoms begin to show up for us, and we can begin to make sense of it all. And therapy helps with that part of the process. And also, after those initial stages, you get in, you're describing those symptoms, and you're realizing certain things are happening that has been causing a disruption, maybe on your job, then in your relationships with others, or maybe even, in your parenting, for those of us that's out there with parents, because some of the trauma responses can be passed down from generation to generation. And so increasing the awareness about just, what's going on, the history of that in your life personally, can help to connect the dots with the ultimate goal to treat those symptoms so that you can have an overall better quality of life, and so that the things that are going on with you will be more manageable in a way where it's not causing a significant disruption for you. And now, oftentimes I say, yes, those symptoms may still be present, but through therapy, you will learn skills to better address those things when they come up for you. Similarly, going back to the physical example, being in that car accident, going back to that example, you get there, okay, well, the doctor said, well, we're going to have to put a cast on this arm or this leg. Okay, this is the plan of care that we're going to come up with therapy. These are some of the things that we're going to do. Let's come up with a routine. And like I said, it takes work as well and effort for both the clinician and the patient or the client. Therapy just doesn't stop in that session. Following up with those treatment recommendations, looking at, reflecting on those things that you talked about in therapy with your therapist. And I even recommend, in those times where you are not to get too technical or too in depth with it, but a part of that process as well, when we're looking at treatment for trauma, is looking at those triggers. And so when you're exposed to a trigger, keeping a log, well, this is something that I realized triggered that fight or flight response, that increasing stress or anxiety for me. Writing those things down and looking at, okay, this is what happened before, this is what happened after, and following up in therapy with that so that you can be aware of how it's showing up, and then begin to put protective factors in place so that when you are exposed to that trigger again, you'll see it coming. And that's how I say you'll see it coming a mile away. You'll already know, okay, I've been here before. I know what's going on. I can identify this, and these are the steps that I'm going to take to make sure I'm okay in this moment. We have any questions or anything so far?
We don't have any questions yet. Thank you, Nikki, for sharing that, for sharing this live. One thing you said, a couple of things. I love what you said about individual care, because we talked about this, and we also said that one size in anything does not fit all. Amen. And I like you were talking about when you were saying a few minutes ago about putting those protective factors in place, we did talk some about setting boundaries, but we wanted to, when we did talk about setting boundaries, the research that I've done, I'm not a therapist. That's not where my education lies, but I did the research that I could share. And one thing that I found when we were setting boundaries, I didn't want it to come off like a boundary was a resounding no, so I was trying to get that out there, how to set boundaries. You talked about, you said the trauma responses, and I passed down that. I didn't know that they were passed down. I did not know that sometimes they could be passed down. And you were talking about how we need to be directly observable, how we paying attention to ourselves. I really appreciate that. I like that. I like that a lot, because for me, my trauma, the trauma happened a lot, like when I was a kid, being I was raped by my dad, and it went on for a long time, from 11 to 14 years old. So I was raped by him. And then I was trying to be good, and I didn't understand that I was trying to be good. But just one of the things that happened as a child for me was when my dad pushed my mom into this closet and was shooting through the closet door. I didn't see that until I became an adult with 2-3 kids. I did not see it until one day I had this guy beating me up, and my kid, it wasn't that the beating me up did not give me that trigger, but because he had done that before. But the one time when he pulled my hair out of my head and my kids started to cry, I saw us as kids crying, asking dad not to kill mom. So that kind of brought back that trigger and forced me to kind of, to try to do something different with my life. So I'm going back to see if anybody has any comments so far, any questions. Not yet.
Okay.
Not yet.
And moving forward with that too, when we're looking at just common symptoms of trauma that can also be treated in therapy, a range of different techniques that are offered, evidence-based practices that helps with that, CBT, exposure therapy, a range of different things, even sometimes medication, if that's what your treatment team decides is best along with you. But a large part of that too is looking at how that stress present, that trauma response, that those responses that we have, when we are triggered in some way. And a large part of that we know can look like anxiety as well. And so looking at that cycle of anxiety and how it's presenting in to help with that, looking at what is that feared perception that you have, or what's going on in this moment that is causing me to look at this situation in a way that's provoking that intense stress or that intense anxiety for me right now in this moment. And that's something that I often say, in this moment, because sometimes it can be described as my thoughts are spiraling. I'm thinking about what if this, what if that, bringing it back in this moment. What is that thing that is that triggering event for me that is causing that increase in anxiety or stress for me in my life? And then looking at from there, I often describe it as, our mind, when we are anxious, our mind is busy. We're thinking, we're going. Some people say, I feel like I'm spiraling, I'm going down the rabbit hole. That's how it's often described. And so naturally what happens, our body is gonna keep up. And so we begin to sometimes experience panic, anxiety attacks. And so just looking at those connections as well, so that you can, what I describe as, break out that cycle. I can see that in this moment I'm feeling unsafe in some way. If that's because of a memory, if that's because of a smell, if that's because of something is reminding me of this overwhelming pain and trauma that I've experienced in my life, I'm back there. Although I'm here presently, my mind is back there. And so breaking out of that cycle and realizing in this moment I'm safe. I'm safe, and that can be helpful. And like I said, therapy, it can help in looking at how can I do that specifically with my trauma and all that I've experienced. What's working best for me? Because there's no one size fit all, like we've said. What works best for one person may not work best for the next. A common example that I often hear, Dr. Davis, I've tried deep breathing. It's just not working. I've tried meditation. It's just not working. And so what works for one person may not work for the next. So finding that thing and not allowing that to discourage you from continuing on your journey to healing.
Yeah, Dr. David, I'm sorry. One other thing that I wanted to ask, because oftentimes, and I know I do this a lot. I like to talk about me rather than other people, but what would be the benefit of a therapist rather than venting to my friends? Sometimes, all this stuff is happening. I'm telling them about it. What would be the benefit of going to a therapist instead of just venting to them and instead of talking about the same problem to them?
Yeah. And let me say this with this disclaimer out there. I know that our loved ones in our family is coming from a good place. They mean well when we're going to them, giving us suggestions and help but the major difference is, as a clinician, we have the training. We know what to look for. We know what, from all of the training that we've had in the experience, because part of that training includes in-depth, hands-on work and getting clinical hours and different things like that. And so based on that, we have that experience and we know what to look for, what directions to go in that has been found from research statistics to be best helpful in treating some of the symptoms that we're looking at. And also, like I said, we know that our loved ones in our family mean well, but oftentimes our family keep a score. Like, okay, now you came the last time and we've been down this road. And so therapy just provides a safe, non-judgmental area for you to, go through that thing over and over and over again as long as you need, without fear of being judged, about, oh, well, she doing this, she back with him again. And we talked about this already, and sometimes too, going to friends and family, venting to them causes just strain in our relationship. Yeah. Because now, maybe they're not I'm not gonna even answer the phone because I know what she's calling about. Or let's say if it was about a boyfriend, a husband, a mate, a partner, whatever. Oh, I don't like him. He put her through all of this, so it's not gonna stop there oftentimes, because we're human beings. And I have siblings, I have loved ones, I have family members, and sometimes because of the care that we have, it's hard to take that step back and be objective when they come to us, because we want what's best for them, even if they're not ready yet to accept what that best thing is, and who are we to say we know what's best? As a friend, as a family member, we just know, okay, I don't like what's going on. And so therapy just provides that support without, that judgment, where you can just be free to let out those concerns, no matter what they look like, no matter what they're presenting as, in a professional environment where you are getting the support based on, evidence, research, statistics, clinical trials, different things like that have found to be most helpful, and we're applying that to your situation and to your treatment.
Yeah, that's awesome. You're right about that. Yeah, you're right about that, because when we go to people, they always give us what they think we should do. Yeah. And you're right, because I know I've gotten tired of people coming with that same thing over and over. You're not trying to fix it. Don't come to me. That's what I'm always saying. Yeah, I know. Yeah, you're right about that. I had a therapist one time that I want to talk about the importance of choosing your therapist, and even leaving if become necessary to get a different one. Because I had a therapist one time, and I'm a Christian, so I said something about, I'm just going to wait for God. I'm just going to start to not move and make these decisions in my life without feeling like this is what God wants us to do. And why did I say that? It went like to something really crazy about, well, God does this, and she went on, and what I really wanted somebody to do. And I think that's what I like to know too. what I really wanted somebody to do was just to talk to me and hear me and let me make my decisions, but guide me
Yes,
along the way.
yes.
That's what I wanted from her. But she went on to tell me, so the importance of making sure that we research our therapist to know what we're getting. Or not, I don't know, do we need to research? And if we do get a therapist that we feel is not helping us, we make that next move.
I highly recommend that because we know that the therapeutic relationship is a heavy factor when we're looking at our clients' progress. And a part of that is building their rapport. If we have a client and they're not comfortable with talking about those intimate things and experiences in their lives, then therapy is not going to be as effective, because if it's not coming up, then we won't know. Now certain things we can observe and we can say, okay, well, they're really not, it's more to this than that. But if the client or the patient is not willing to open up in that way because they're uncomfortable or because they don't feel like they have that relationship with us, I often recommend find another therapist. Fine. And that goes back to what we've been saying. There's no one size fit all. I often say this because I'm an open book in my practice. When I'm working with others, I know I'm not for everybody. And that's okay, because as a person, individually, we bring some of that of who we are into those sessions, and that may be a bit much for some people, or some people may feel like I want an older therapist, or whatever those things, our preferences are, and that's okay. That's okay. You have the autonomy to decide what you want your treatment process to look like and who you want to provide that service for you without feeling guilty. It's kind of like going to the mechanic and going, and then I win, my air conditioning is not working. You said this was the issue, and we're doing this, but it's still not working. I may need to change mechanics to see, to look at what's going on. And so
yeah, you got a very some valid points. Let me see if there are any comments. Well, I don't see any yet. But one thing that really helped me in therapy was that the therapist was able to take me back, because like you said, when trauma sometimes surfaces, it comes when there's an opportune time for it to be expressed. Yeah. So when the trauma came back in my, well, two things. Let me go back one. The first thing was you talked about being able to talk to that therapist because of our family. When I started to do this, I started out just writing my book. I wanted to put my life out there because I know that my purpose and my purpose in life is to help other people to get better, and also to share that information. We have Dr. Rose Swoop on the line. Thank you for joining, Dr. Swoop. Anyway, I wanted to help other people. So that's my train of thought, but I'm going to go back to the other one that I was going to say. One thing that the therapist was able to help me with was to, like, she was able to go back into, I didn't know my problem was still from childhood. I did not know that. I was just at work, best time in my life. I'm at a great job and I'm like happy, and I couldn't stop crying. So I didn't know that. And what she did was, for me, was like, I think I shared this before. She said to me, well, what do you think about that little girl, Rosie? And it felt, when she said it, it wasn't me. I'm like, I hate her. When I said I hated her, I did not know that I hated. I did not understand and know that I did not like myself. I did not know it until she said it that moment. So it has been really, therapy has been really a blessing in my life. Saying no was hard for me. And what I was going to say before, when you were talking about seeing a therapist instead of talking to that family member, even when I wrote my book, I did it because I wanted to share my story. I felt like I was the only one. I was not the only one. When I was giving birth to my kid, I was in the bed having a baby, didn't know that baby was inside of me. I was the only person who had a family, a dad who was raping them I wasn't the only one, but people would come up and say a little something, but they don't give you the backstory. They don't tell you how it affected them.
Yeah.
And I wanted to put it all out there. And my family members were saying to me, well, you don't put you don't put your family business in the street. But that's exactly what got us into that position in the first place.
Yeah.
Dad was raping me. Nobody's supposed to tell anybody anything. And it was that's what got me there in the first place. But we couldn't get any help because we don't tell the truth. And the last thing I'm going to say, let you go back, even in a lot of time in marriages, at church, which is sad. My mom and dad had been married for 30, 40 years. I don't even know. And they would get up in church and they would, be like praising him and her for being married 30 years and 20 years. And I'm saying to myself, but he's raping her daughters. He's beating her sons. Why aren't you telling the truth? Why aren't you helping somebody? And that's why I wanted to come on here. That's why I do what I do.
And you know something too, we have to individually, it's so many, we have so many messages that we internalize that are passed down, through our families. You don't supposed to let outsiders know what's going on. And it's a facade to protect the image, oftentimes the image that we want others to see. But then what we do individually is begin to carry those things around inside. But the way that I describe it has got to come out, and it will come out in some way, but we have to be ready to acknowledge what that is. We have to, be ready to know that, okay, I know what's been going on. From what I know, like you said, you just started crying at work, and that was the warning sign to you that, hey, something is going on here. Let me reach out, let me receive that help. But getting to that point where we know I need the help. This is not normal. No matter how much I've been told that this is normal, because sometimes we don't know what normal is until, we see differently. Until we see differently. And, we create our own normal. That's true. But sometimes, that's going back to that comment that I made earlier. Is this causing a disruption in your life in some way? Is this causing me more harm than good? And starting there after you're doing that self-assessment and looking at what that thing is, and that's a bold step to make. That's a bold step to make. And not everybody, even when we're looking at the trauma within our family, for an example, I may be ready to address what's going on, but my sister may not. And so because of that, I often say, you have to go at your own pace because this is your journey and not allowing anybody else to take that away from you.
You said that at the beginning. You said individual care. It's my individual care. And I think that's another thing that we have to respect people individual care. I need this for me to feel whole. I need this to take care of myself. I need to get it out of me. Now, if you don't want to get it, if somebody else chooses to not, I have to respect that fact. I have to respect that they don't want to. We have a couple of comments. Thank you for Danetta for joining. And I said Dr. Swoop is on the line. And Danetta she says she never gone to therapy, but she's enjoying the topic. I think it's an awesome topic. And then Dr. Swoop said, I brought your book and I was discussing it this morning after our prayer. Phenomenal and courageous. Thank you. Oh, you're welcome. Thank you for buying the book. Yeah, thank you so much. Because I knew that I didn't know who it would help. But one thing it did, it was a purge for me. It helped me. It really helped me to get it out there and to tell the truth. And so, like, I don't want skeletons in my closet, especially if they're the kind that's going to bind me or the kind that's going to hurt me. If that's going to hurt me, I don't want to do it. And I'm finding out a different thing, because I got a new therapist that I'll be talking to some things about as I make these life changes. I'm having a hard time with that. I'm having a real hard time with making these changes, with setting boundaries. And what happens when somebody doesn't listen to my, when I'm trying to say this is what I need and it's not being respected. And the people trying to pull me back into, to think the way they think. We got it, individual care. I love that. Thank you.
You're welcome. And with that, I hear you too. I hear you're on that process, because that's what it is. It's not okay, I'm gonna go to one session, I'm gonna go to two sessions, and I'm gonna be fixed. That's it. No, it's a
No.
process. You have to continue that work in that therapy session, and following with those recommendations even outside, when you're at home, or when you're, just in your natural environment, reflecting back on that thing, so that you can make those changes that you want to see in your life.
Yeah, when I first went to therapy, the first day I went, I've been in therapy since 1992, and I found
Mm-hmm.
that I continually need it all the time, because the
Mm-hmm.
trauma will come in when there's a space to express it, but
Yeah.
life still goes on, and that
Mm-hmm.
everyday life, I still need therapy, and I still need assistance working through it. What would you say about how many times that you've helped people who come into the office like I did the first day of therapy, and I told that lady, no, I don't need therapy. I'm okay. I don't want to talk about it. And now I find myself all these years later feeling that it's the best thing in the world for me.
Yes,
what,
yes.
what, how often does that happen for you when they come in like that?
You will run into some, but the thing is this: you were there. So
Yeah.
with that, I'm sure that clinician know she wants it. She's probably just afraid, or she's probably just intimidated about what the process will look like. And so just knowing that, because you have already began the work, because you took the initiative to make that appointment, you took that initiative to show up, and so
Yeah.
that's showing me she's motivated right now for care. And
Okay.
so we have a saying, meeting that person where they are. Let's start
Yeah.
small. How have you been? How's your day been? Getting to know each other before just jumping into the large part of that trauma and what's going on, because too much too fast can be overwhelming.
Yeah.
And that can be frightening, oftentimes, I hear sometimes where those that I'm working with will say, this is a lot. I didn't know all of this was going on, and so starting small and kind of like peeling back the layers to, we would say, the onion has many layers,
Right.
peeling back those layers and starting small, but at the same time providing the encouragement and support that you need to continue the journey that you started.
Yeah. Wow. Wow. Ladies on the line, do you have any questions? Okay.
Mhm.
Yeah, it's really hard. I'm
It's a
glad.
lot. Yeah.
Yeah, because I'm learning a lot. I'm learning a lot even as I go. Because when the first day when he said I did, thank you for that. I went to counseling. I went there, and then when I got there, I'm like, well, I think I'm gonna go back. I was at work. I'm gonna go back to work. And she's like, well, no, you don't have to go back to work. You can come in and sit down. I said, I don't want to sit down. And I started to cry. And not loud, but she saw the tears. She's like, well, you can come and cry if you wanna.
Mm-hmm.
But I've been crying all of my life.
I'm tired of crying.
And that's how it started for me. I've been crying all of my life. I'm tired of crying.
I can imagine.
But yeah,
But that's what we're there for in those
yeah,
moments, even if it's just sitting to allow those tears to serve as a cleansing moment for you, because it
yeah.
can be a cathartic release in that way. And even oftentimes I will say in those situations where, sometimes words are not enough, you need to express that emotion, but afterwards, what are those tears saying in this moment?
Yes.
And reflecting back to right now, and just letting this is a safe space.
Yeah,
Whenever you're ready, I'm here.
yeah, that's what it provided too, a very safe space to cry. Because like I shared last week, when things happen in our lives, especially sometimes as being a Christian, sometimes I found a lot in church and outside as well. Like when I told them that sometimes, when you start to cry, people like they pat you on the back and
Yeah,
like,
yeah.
it'll be okay. It's not okay.
And it may not be okay, but
Yeah,
guess what? I'm gonna help you to get through it.
right. Let me be authentic. We got to be authentic,
Mhm.
and we can't be authentic sometimes with people that's trying to make us be who they think we should be, act the
Mhm.
way we got to be politically correct over here and do this like this. No, I want to be authentic, the good, the bad, the ugly. It
Mhm.
all made me who I am. I
Yes.
want to be me at any cost now, and it does cost sometimes.
Yes, it does. It does. But we have to be at that point where we are ready to receive whatever their charge is,
Yes,
and still be able to move forward, even though we know that it's hurting, even though we
yes,
know this is taking a lot from me. But in the end, what are the rewards?
yes, yes,
Mm-hmm.
yes. To be able to just be free and to be authentic and to
Mm-hmm.
be whole.
Yes,
I don't
ma'am.
I don't see any questions. Let me go back.
Okay.
No, I don't see any questions.
Okay.
Okay, but yeah, yeah, yeah. Even to the point where I'm now trying to even go through and work through. I'm just, this is so silly to me to say, but to
Mm-hmm.
understand what a friend is,
Mm-hmm.
and even to losing people not purposely, because I'm the last person that ever want to cut
Yeah.
anybody out
Yeah.
of my life. And I but I found myself for too long. Oh, I have a real issue with silence. Oh, okay. Yeah, that yeah, she say I have a real issue with silence when I'm expressing hurt or pain and no one responds.
Mm.
Yeah,
Yeah.
I can understand that. Sometimes
Mhm.
they don't know how. They have a lot of time.
Mhm.
I'm finding that I run into a lot of people. I'm trying to get them to understand me, and they trying to get me to understand them at the same time. And that's the
Mhm.
good thing about the therapist. So when you're in a conversation with people that you're talking to, it's like 50-50. You have to
Mhm.
listen to me. I have to
Mhm.
listen to you. Try this. If you tell somebody that you cook dinner, and you tell them what you cook before you can get to the dessert, they're gonna tell you what they cook.
Mhm.
But with
Mhm.
therapy, I know that with therapy, when you go into therapy, you got that 100% person that's really not worrying about their issues, not telling you about theirs, but they're listening, and that was so
Mhm.
important.
Mhm.
Yeah. People a lot of times people are hurting. The more we understand trauma, the more we understand trauma triggers, and then I don't get angry so much at people when I find that they're doing these things to me,
Mhm.
because a lot of times I realize that they don't know either,
Mhm.
and if they're going through some things, and if they're not able to face those trauma triggers and manage them, they won't know how to help. They don't know how to they don't know what to say. And it's best sometimes, I don't know if it's best to be silent when you don't know, but yeah.
And then too, as a clinician, we are trained to listen.
Yes.
There are certain techniques, certain things, just with that training. So we're training that way too, so that we can be fully in that moment with the client. As they're expressing those needs, because that's what it is. And you mentioned boundaries. A part of that, boundaries serves to help us communicate our needs. And help us communicate those things that are acceptable, that we are saying are
Right.
acceptable and unacceptable. And these are the things that oftentimes that has been posing as a barrier for us in some way. They've been causing an interference in our lives in some way. And so
Right.
boundaries serve as a way to protect us mentally and emotionally from these things continuing to happen in our life. And oftentimes too, just going back to that statement that was made, when we find ourselves in those situations where I find this moment or this thing really tough for me when I'm interacting with myself, that's key, and when I'm
Mm.
interacting with other people, what are those cognitive errors, those internalized messages similar to what we were just talking about, that I have, that when I listen to them, they cause me to feel even worse. Or they cause this to happen that I don't wish to continue to happen. And for an example, this is an example just for me personally. Silence to me feels like I'm not being heard. And
Mhm.
that makes me feel ignored. And I don't like feeling ignored.
Yeah.
But in that moment, is that true?
Hmm.
So checking with myself in this moment, or is that my inner child? Something you said too, going back to that, is that my inner child in the past that are resurfacing in this moment, that's making me feel like I'm unimportant because you're not listening, because you're not responding.
Wow.
you know. And so just checking in with ourselves about that too. And that's the process, and even recognizing what those cognitive errors are, you know, what the in cognitive errors, like I said, are just those maladaptive or those problematic thought processes that we carry around with us, that, you know, when we think on those things, that cause impairment for us, you know, cause immense and emotional decline in some way, you know, and they cause strain in our interactions, like I said, first with ourselves and then with others. And so and it's more to it than that, but just, you know, a summary of what that can look like. And so looking in at that, what message am I telling myself about whatever this interaction is that I'm having? You know, am I having black and white thinking? It's either all or nothing for me. You either all in or you all out. Ain't no in between. you know. So looking at those different ways that we think about things as well can be helpful in restructuring our thought process to be more healthy.
That Rose Swoop said, that's it, Dr. Henderson. All of that. That's how I feel. Yeah, all of that.
I'm telling you, yes, ma'am. Yes,
and
ma'am.
Thank you, Cora, for joining as well. Thank you so much. Yeah, I promise you, it's a lot, but it's amazing too. I thank God that we're at least we're recognizing this stuff, because so long my trauma surfaced in different ways. I didn't know that these things was the problem. I didn't realize that I didn't like Rosie. I didn't realize that I was in my trauma was response was fine. I was becoming a people pleaser where I was totally disregarding myself. I didn't even realize that stuff was happening. If anybody had asked me, did I have low self-esteem, I would have been no, because I always felt like God had me. I thought I did. I felt like I was all of that in a bag of chips. I thought I felt that way, but my reactions was saying something totally different.
Yes, and a large part of that can be a defense mechanism. I'm going to hype myself up so much and make myself think that I have high self-esteem, when in reality, if I take a further dive and look in examination into myself, how am I really? And there's a common strategy that I often use in therapy, where it's called the mask activity, where we have our inner selves, our true selves. This is how we feel about ourselves, you know, and then we have the face, the mask that we show the world, and oftentimes those two are completely different, and that internal conflict comes in where those differences appear, you know. And a large part of the time we do that as a defense mechanism, as a coping strategy. You know, I've heard so often, well, if I show who I really am, will people accept me, you know, or will people continue to say, what's wrong, and we know that can be irritating. You know, I just want to go out, you know, show the world my best face, whatever I feel like that is today, because that can change moment to moment. That's you know, and move forward unbothered.
Wow, it's amazing. Wow, ladies, do you have any? I found out. Okay, who is this? Let me just read this one for you. That was Corey. That's how I feel. And then she said, I have found out. What am I going to? I'm so sorry. I want to make sure I'm not missing anybody. I found out that no matter how we try to hide our actions, will always at some point betray us.
That is so true. That is so true. I give the analogy oftentimes, it's like, you know, we're busy in life. We have things going on. And sometimes truly we can't sit with everything that's going on. But oftentimes, you know, we're going, things happening in our lives, you know, this is going on, this is going on. And we say, okay, well, I'm just going to put this to the side. I'm going to put that in the closet. Okay, something else. Okay, well, I can't deal with that right now. I'm going to put that in the closet. And we're going, but eventually that closet gets full and that door is going to come spilling open, and everything is going to come piling out, and it's going to happen. Sometimes it can be I'm going throughout my day, and then all of a sudden I'm just like, what? You know, my mood has changed significantly, and everything that I've been holding in is spilling out. And so it's helpful to address those things that when they come up during the time when they come up or they appear in our lives, to prevent that spilling out, you know, or to prevent that overwhelming moment where it feels like the weight of the world is on my shoulders.
Yeah, it's just hard. Danetta Anderson is saying, and then she said, my fear is dealing with cancer, where her body's going through cancer now. How to deal with this? I can't accept it in my brain. I can't accept it, and my brain keeps saying no, but the doctors are telling me yes, I do. She's going to try to, like believe something different than what the doctors are saying. I'm afraid to talk about it, and how do I really put myself how do I really put myself with what's going on? Like, I'm afraid to even put this out now. Trying to, the doctor's saying that you got cancer, but you're trying to, I guess, not name it and claim it. But the doctor's saying you got it. I guess that I'm saying it the right way. But you're trying to be positive and not admitting, not to say this because of your faith. But this is what the doctor's saying, and how do you? Oh man, that's deep.
Wow, that's a tough spot to be in, especially when you're dealing with, an illness as chronic or, as heavy as the diagnosis as cancer can be. I'm sorry to hear that you're going through that right now. It can be challenging, and a large part of that, we do have to look at, those coping strategies that we can use to strengthen us, because it goes back to something that I said earlier. Sometimes those feelings are not going to disappear. Sometimes those symptoms are going to be there, but learning ways to effectively manage those feelings of fear when they come up for you, and sometimes that looks like addressing exactly what that fear is, and it can be hurtful, it can be painful, and so I often recommend, when you're ready to, allowing yourself that time, because we do know as well, clinically, going through challenges such as illnesses like cancer, it takes our life in a direction where it's a transitional process. We are also having to go through stages of grief. Yeah. And that comes about with a whole range of other different emotions, and fear can be a part of that. And so looking at that exactly, for how it's showing up for you, what does these feelings of fear, what thought am I attaching it to? And going forward, working through it that way. And even with that too, it can be helpful to, write those things out as you're finding those connections, and then looking at, those supports that are in place to help you through this time right now.
Yeah. Wow. Wow. Yeah. Yeah, that'll definitely keeping you in our prayers and in our thoughts.
Yes,
definitely here for
ma'am.
you.
Yes,
You're not
ma'am.
alone. It's really hard because
Yes,
sometimes I find sometimes for me when I don't know what to say is to not to say anything.
Yes, ma'am.
Yeah.
Mm-hmm.
She said thank you so much. She said thank you, Dr. Henderson.
You're welcome.
Yeah.
You're welcome.
Yeah. I'm really thankful for today. I'm thankful for you all. I'm thankful for you coming on and stuff. I don't know, we may be asking Dr. Henderson to come back again another day, but I really really appreciate you taking the time out of your day, to come and talk to us. And counseling is so important. Therapy is so important to find that person who's mind is not already made up about you, don't already know you, and who's willing to listen to hear you, and really to just that's what they're trained to do, and they're obligated by law. They're not going to tell your business,
Right.
This information that you put on here is only on this live. It doesn't come on Facebook, so I won't put your comments on Facebook in case if you want to share that, you can do that. But I know you put it on Facebook, it doesn't show on our Facebook live. They don't see these comments, so we can leave these right where they are, and if you want to share that, that's up to you. But I don't want to get into that, do things that I shouldn't be doing either. But really, thank you all so much. Is there anything else, any other comments? Did you have anything else, Dr. Henderson, or any other comments that you'd like to leave with us before we do our affirmation?
No, ma'am, I don't. I thank you all for having me this morning, and hope that something that was reviewed or said, or those shared experiences we looked at, have been helpful and enlightening in some way.
Absolutely. Hi, Annette. Thank you so much. We're getting ready to end, to end today's discussion. We've been on, but you can always go back on YouTube, on Facebook, and I will be posting this on YouTube. You can go back and see the video. You won't see the comments, but the video. So our affirmations for today is our core DNA is whole. We're whole. It includes our identity, our individuality, our personality, and our emotion. We are individually whole.
Mm-hmm.
We call back all parts of ourselves. We are not fragmented in anything. We honor ourselves by being authentic. We're actually and exactly who and what we claim to be. We are always a safe place for ourselves.
Mm-hmm.
And we keep this one from Sister Shirley. Today is a great day to have a great day. Even with the things that's going on in our lives, it's a great day to make up our mind. As Dr. Henderson say, we're living in the moment. When we find that a situation of this moment is causing some type of reaction that's outside of what's happening at this moment, is more than likely hysterical. So if the hysteria is doing something way outside of this moment, it's more than likely hysteria. And our getting a therapist and going to counseling will help us to find out what it is in our history that's causing us to take this moment the way that we're taking it. And it's always, most of the time, I don't know how often, but most of the time, I find that when our responses are because of something in the past, we don't want this anymore because we were hurt there, and we make those decisions, based on a lot of times not based on what's happening in the now.
Mm-hmm.
Said being in the now, we want to bring our life to the now, right this minute. We can't change what happened in the past, but bring it to the now.
Mm-hmm.
Yeah. If that, I want to thank you again. Thank you everyone for joining. I will definitely be posting this video to YouTube and talking to you all again. Thank you so much again, Dr. Henderson.
You're welcome. You're welcome. It was good being here. You all take care.
All right. Love you. All right, everybody. Talk to you soon and have a great day. Thank you so much. Goodbye.
Bye.